Well, we all know what happens this time of year. It is open enrollment, and you know, it can be daunting and confusing, but there is some help out there. Brian Will, the CEO of Health Solutions One, is going to tell us how he can help because it is overwhelming and confusing. You have to get health insurance or you get penalized, but some people don't even know where to start.
That's correct. You are required to buy it between now and the end of January.
So you don't really have that much time.
Nope, we have about 12 weeks left.
12 weeks. And tell me, someone who's at home and they don't get it through their employer, they can't, they come to you, and how do you help out?
We basically shop every product that's in the market. We find the best price for the best product. We qualify them for the most amount of money they can get in a subsidy from the government, which gives them the cheapest price, and then we help them sign up.
And you said you can actually sign people up for not very much at all, a lot less than what people would think.
Yeah, the government's telling us this year that 8 out of 10 people that will purchase health insurance are going to get a subsidy. The government's giving away billions of dollars. The average premium for health insurance is less than $100. And we have many clients that are paying $25, $30 a month. Some are even getting it for free. Wow,
and getting money back on top of that.
That's correct.
So if someone needs help, what do they need to do? They need to get all their papers in order? How does it work? How many things do they need to collect? Is it hard?
No, really, they just call us. We have a licensed agent that's on the phone that'll walk them through the process. It takes about 10 minutes. We can tell them how much money they qualify for, what their end price is, and then we can help sign them up.
And a lot of times it's obviously a lot cheaper than the penalty, right?
Yeah, the penalty is growing. It's a percentage of your income these days, so okay. You really don't want the IRS coming after you.
Okay, and tell me about the health plans this year, what they have to offer. Does it depend on how many people you have in your family, or if you're working? How does it work?
It does. So the price depends on how many people in your family. If you're single, married with children. There's four types of plans that you can get, anywhere from a low-cost plan up to what we call a platinum type of plan. And then our particular company also offers what we call gap coverage, and that gap coverage takes care of deductibles, it takes care of emergency room coverage, doctor visits, some of the things that the healthcare plans don't cover.
And do you find that a lot of people kind of wait to the last minute to get help and do this, or what are you finding?
We do, and I'll tell you right now, some of the carriers are already on a 1-hour wait just to talk to somebody, and by the time you get to January, those waits can go 2, 3, and 4 hours at a time. So it doesn't hurt you to shop now. The plans don't go into effect till January anyway. Might as well get it out of the way. Then you don't have to worry about the wait later on.
And kind of get your plan. And a lot of times it's confusing to know which plan is best for you. Do you have options?
We shop every plan in the market. So when we talk to you, we'll say, here's all of your options by carrier.
So A, B, C, D, pick.
Here's the best price. This is what we think we can do. Here's how we'll cover your deductibles.
And what kind of reaction are you getting from people? Because people probably think it's a really complicated process, but you make it easy.
We do make it easy. We again, because we have everything on our screen and because this is what we do, we can tell them what the best plan is.
And how long have you guys been doing this?
Our team's been doing this for 20 years.
20 years.
Yeah.
And now that you have all these plans and insurance is changing every year, I'm sure the process is a little different over the years.
It has changed a good bit. You know, everything's run under one central website now for the state of Georgia. But the nice thing is it does make it easier for us to shop all the different carriers.
And what do you find is the most common mistake people do, trying to do it themselves?
Yeah, again, if you try to do it yourself, you're going to see a list of a couple of hundred different products. And without having specialized knowledge in the insurance field, it's going to be tough for you to make the right decision.
How long does it take? Once we call you?
10, 15 minutes.
That's it?
Yeah, it's pretty
Whereas
quick.
if we probably tried to do it ourselves, it would take hours, days?
Well, we find that most people that shop on our website end up calling us anyway because they get confused.
It's overwhelming. It's confusing. It's crazy. Thank you so much. Yeah.
I was going to say, the other thing is, even if you have insurance, the government's told us that prices are going up.
Right.
If you have it, you still need to shop.
Yeah, shop around.
We can save 80% of people that have insurance. We can save them money.
I love it. Thank you so much, because it is very overwhelming. We're doing it here where we work, and it's a headache. To learn more, just log on to healthsolutionsone.com.